Hello, my presentation is going to be over cystitis. Cystitis is inflammation of the bladder wall, which is most commonly caused by a bacterial infection. With bacterial cystitis, the bacterial travels through the urinary tract system and makes its way into the bladder, which there multiplies and slowly but surely causes discomfort and inflammation. Women are more prone to cystitis because of the shortness of the urethra. The bacteria does not have far to travel through the bladder compared to men. Um, the bacteria that can be harbored in the genital area of a female makes them more of a target also. The bacteria that's the most common culprit for these is called E. coli. UTIs are also the most common in people that require urinary catheters. UTIs are also the most common type of nosocomial infections in the U.S., which are the hospital-acquired infections. There are also ways to acquire cystitis that are not always infectious. Some being drug-induced, which are caused from medications, radiation, people that are taking chemo or having to go get treatments, chemical, which include like bath bombs or bubble baths, and some can come from prior conditions such as kidney stones or diabetes. There are also some women that are more at risk. Those include women that are pregnant, women that are on birth control, women that have gone through or are going through menopause due to the fluctuation of the hormone levels. The risks that affect both men and women include not emptying the bladder frequently enough, a person's immune system changing, like they're going through cancer treatments, influence of the flow of urine can be a factor, and bladder catheters also. There are a list of symptoms that you would consider bad, such as fever, chills, consistent, pain in your back or your side, and vomiting. These could mean that you have an infection of your kidneys, that the infection has spread, and once it gets to your kidneys, can be very life-threatening. Some mild symptoms, which you could possibly get over on your own without having to go seek medical attention, include burning sensation while you're peeing, a consistent urge to urinate, pelvic discomfort, low-grade fever. Those are all what you would consider mild symptoms. Just make sure that you drink plenty of fluid, lots of water. Make sure you do your best to just lower your risk of getting this cystitis. Some include taking showers instead of baths. That can lower your risk. When you're using the restroom, wipe front to back. Avoid spraying feminine products or deodorants down in the genital area. All those can just can be really bad and definitely raise your risk of getting a bacterial infection. And that's it. I honestly, I didn't know that I had ever had a UTI. I guess it was just a very mild one. I've had some of these symptoms. I just, it went away on its own. But I didn't know that I had one until I researched all of this. Well, thank you, and I hope I see you guys soon.